Namaste, good evening. I'm Dr. Lakshmi Nagendra, and on behalf of the Endocrine Society of India, I take pleasure in welcoming all of you to today's session. So, this is the Facebook Live, which is an initiative by the Endocrine Society of India to spread awareness about the common endocrine disorders. So, it's October, and we are going to be celebrating the World Osteoporosis Day on the 20th of this month, which means this whole month is going to be about osteoporosis awareness. So, all through this month, we are going to strive towards creating awareness about osteoporosis and fracture prevention. And I'm very excited to be kickstarting this whole month program with today's session. So, there are various aspects to bone health, and calcium is one of the very important determinants to bone health. So that is the topic for today's Facebook Live, and we are going to be discussing on how we can ensure optimal calcium intake to ensure bone health. So there are a lot of myths and misinformation floating around about if all elderly citizens need to take calcium or taking calcium supplements will lead to renal stones, or is calcium really required to prevent fractures. So to shed more light on this, we have with us three eminent endocrinologists, and it's my honor to welcome Dr. Nilanjan Sengupta, sir, Professor and Head, Department of Endocrinology at NRS Medical College, Kolkata, Honorary General Secretary, Endocrine Society of Bengal. Sir is also on the Governing Council member, RSSDI West Bengal Chapter, Secretary Board of Studies in Endocrinology, West Bengal University of Health Sciences, and Sir is a prolific academician with more than 80 publications in national and international journals, and is also the Associate Editor of the Indian Journal of Endocrinology and Metabology. A warm welcome to you, sir.
Thank you. Thanks, Endocrine Society of India and Dr. Mohan Shenoy for inviting me to this Facebook Live. And I take this opportunity to wish all of you, each one of you, a very happy Navaratri and Durga Puja. Over to Dr.
Thank,
Lakshmi.
thank you, sir. Honored to welcome Professor Debmalya Sanyal, sir, who's a professor, Department of Endocrinology at KPC Medical College, Kolkata, Conjoint Professor, School of Medicine and Public Health, University of Newcastle, Australia. Also visiting senior consultant endocrinologist at GD Diabetes Institute, AMRI, Kolkata. Sir has a number of publications and is also the reviewer of national and international journals of repute like Clinical Endocrinology, Endocrine Practice, IJEM, and a host of others. Sir has been the recipient of a number of awards, travel grants, and is also involved in a number of clinical trials in the field of endocrinology. A warm welcome to you, sir.
Thank you, and thank you for the invitation. Thank you, Endocrine Society. And again, I would like to thank Mohan Shenoy. And also from Bengal, we would like to wish Happy Durga Puja and also Navratri, Happy Navratri to all of you. Thank you.
Thank you, sir. We're honored to have with us our third panelist, Dr. Nishant Raizada, sir, who's Associate Professor, Department of Endocrinology at UCMS and GTP Hospital, New Delhi. Also the Treasurer, Delhi State Chapter of the Endocrine Society of India. Dr. Nishant has been the recipient of numerous awards in his career and is also the Deputy Executive Editor of IJEM and also the Associate Editor of IJDDC. A warm welcome to you, sir.
Thank you so much, and thank you to Endocrine Society of India for inviting me here and being with such an elite panel. Thank you.
Thank you, sir. So before we start with the questions for today's session, I request Professor Nilanjan Sengupta, sir, to share a few thoughts about the theme for the month and also for today.
Well, osteoporosis is an important public health problem which is probably underrated, underestimated, underdiagnosed, with the patients having to suffer. So, we have to increase the awareness of osteoporosis both in the minds of the patients and the treating physicians like the orthopedic surgeons, endocrinologists, general practitioners, and so on and so forth, because the main problem of osteoporosis, that is postmenopausal osteoporosis in particular, is the issue of a fragility fracture, which brings with it a lot of morbidity as well as mortality too. But today's topic, I think, is calcium and how to optimize calcium intake. We know calcium is an important micronutrient that helps build bones, that everybody probably knows. But beyond bones, calcium has also some role in maintaining the vascular tone, in making the heart pump properly, and also prevent hypertension, especially in pregnant women. So, calcium supplementation has a role in preventing hypertensive disorders of pregnancy. A good calcium environment is also helpful in preventing or mitigating dyslipidemia, that is, lipid abnormalities that can eventually lead to heart disease, heart attack, heart failure, stroke, peripheral vascular disease, and so on. And a good calcium environment is probably also important for colorectal adenoma prevention, that is, prevention of tumors of the large intestine. So, role of calcium is largely predominantly in maintaining bone health, but that is not all. It has beneficial effects beyond the bones too.
Thank you, sir. As you rightly said, calcium is so integral to so many of our normal functioning of our body, which we'll be speaking about more in the session. Now, I invite Professor Debmalya Sanyal, sir, to share a few thoughts before we start off the question.
Yes, again, would like to re-emphasize that the bone health is probably one of the most neglected aspects in overall medicine as well as in endocrinology per se, and also patients generally present or come when they have had fractures, or in young age they have deformities like rickets. So it presents across the spectrum, from the uh, beginning from childhood till in elderly. They can have different manifestations, including cardiovascular manifestations, neurological manifestations as well. So it's very important that we raise the awareness with regards to bone health, and particularly osteoporosis, which is not only associated with bone health but also is associated with significant morbidity and mortality as well. Now, with regards to today's topic, calcium, again, calcium is a very important component of building and maintaining bone, and also different aspects of our heart function, muscle function, as well as neuromuscular functions as well. And though diet is primary source of calcium in our body, but we also need to relook whether we are having a proper diet, we are maintaining that diet in different phases of our life, and when and where and which supplement do we require, and which is the appropriate intervention which is needed. And also, very importantly, we also should be careful with regards to inappropriate intervention, which is also not uncommon. Thank you.
Thank you, sir. As you rightly said, osteoporosis is one of the most neglected disorders, and fracture prevention does not take importance as much as it should be, because the morbidity and mortality associated with fractures is huge, and it takes a few simple steps to prevent fractures. Hopefully, we'll be shedding light on how an optimal calcium intake can help us maintain proper bone health and hopefully prevent fractures. So, sir, Professor Debmalya sir spoke about diet being the primary source of calcium. Sir, my first question is to Professor Nilanjan Sen Gupta, sir. Sir, could you please tell us which are the animal-derived sources of calcium?
Yeah, the most important animal source of calcium, in fact, animal source is the most important source because the content is more and the bioavailability is more, meaning that whatever calcium you ingest, that the body will assimilate most of it if it is consumed through animal sources. And among the animal sources, the major are the dairy products, that is milk, cheese, yogurt, so on and so forth. Milk contains something around 100 to 180 milligram of calcium per 100 gram, and cheese contains around 1 gram of calcium per 100 gram. So that is just to give an idea the how rich these food materials, food items are in calcium. And just because these are not combined with phosphates and phytates, which are the case in case of plant sources of calcium, the bioavailability or assimilation of ingested calcium into the body is better with animal sources of calcium.
Thank you, sir. As you rightly said, the bioavailability with animal-based sources are much, much more, and they are one of the major sources of calcium that we have. But some of our patients are vegetarians and say, are not able to take the animal-based products, animal-based sources of calcium. Professor Debmalya, sir, could you throw light on what are the plant-derived sources of calcium that some of our vegetarian patients can take to ensure optimal calcium intake?
Well, again, with regards to, as Professor Niranjan Shamgupta said, the animal-based sources of calcium have better bioavailability, but we also have some good plant sources like nuts and seeds, which can have, especially like almonds, which can have a significant amount of calcium between 250 to 600 milligram per 100 gram. Then, especially green leafy vegetables, especially green leafy vegetables like cauliflower, like broccoli, these contain a significant amount of calcium between 100 to 150 milligram per 100 gram. And again, we have cereals as well, which can provide somewhat lower amount of calcium, like 30 milligram per 100 grams. Again, a very important source of calcium, especially in our country with a huge number of people who are vegetarian, is with regards to different grains, especially with regards to different dals which we have like black gram, Bengal gram, and other uh, grains which can have a significant amount of calcium as well. One thing we need to remember, especially with regards to vegetables, where we have less intake of raw vegetables. So, if we have vegetables, especially in the form of salads, green vegetables, and also less boiled, then the source become richer. But if it is too much boiled, which occurs especially when we cook it, or then the availability would decrease significantly. So these are areas where we need to be careful, and especially in women and children where the requirement may be more, we may fall short in this account in vegetarian subjects.
Thank you, sir. My next question is to Nishant, sir. So could you please tell us if the consumption patterns in the population could affect calcium intake?
Thank you. So, if you look at the global consumption of calcium, you'll find that most of the countries in which the calcium intake is adequate, they come from the Western developed societies, and parts of Europe, so the Western Europe, and maybe parts of America are the areas which have the highest calcium intakes. On the contrary, if you come to Asia or Africa, then the calcium intakes are much lower. And when you go down and see what is the component of the this calcium intake in terms of what diet is being consumed, you'll find that the dairy intake has the highest in Europe and in the Americas. And on the contrary, the majority of the intake is coming from vegetarian sources in Asia, including in India. So as both the other panelists have alluded to, majority of the calcium absorption and the highest amount of calcium is there in the dairy products. Therefore, populations which consume more dairy are more likely to have a better calcium intake as compared to those who are dependent upon the vegetarian sources. So those are the considerations. And further, even from the vegetarian sources, as Professor Demal sir alluded to, it is the raw vegetables and the green leafy vegetables which contribute. But unfortunately, with urbanization, we are moving away from these foods to more refined foods, maybe to more of junk foods which don't contain as much amount of calcium. So that again lowers the calcium intake. And although India produces a large amount of dairy and dairy products, but the population is not rich enough to buy the enough quantities of dairy. And those who are probably in a position to buy, they are probably choosing to not buy dairy and maybe go for refined foods, etc. So which in turn is leading to a overall lower intake of calcium in India and many other countries like India. Thank you.
Thank you, sir. I think we should be making a conscious effort to consume calcium-rich foods and move away from refined foods, not only for optimal calcium intake, but I think for overall health as well. Nilanjan, sir, the next question is to you. We know calcium is very important in the growing years for something that we call for attainment of peak bone mass. Could you tell us the recommendations for calcium intake in children and adolescents?
Yeah, let me have the chart. Well, calcium requirement varies over different phases of life. The average FAO/WHO recommended daily allowance ranges from 300 to something around 1300 milligram of calcium per day. Now, this why is this big range? Because growing children, pregnant and lactating women will be requiring something around 1200 to 1300 milligram of calcium per day. But otherwise, average adults who are not growing children or not being pregnant or lactating will do with much lesser amounts. Now, even you, I just quote one data. For 0 to 6 months, the recommended calcium intake is around 300 to 400 milligram per day. 6 month to 12 month is around same as 300 to 400 milligram per day, climbing to around 1300 milligram per day in the peripubertal years. So that's how, along with age, the calcium requirement increases. But I think for the average viewers, it is suffice to know that the calcium requirement varies over the period of life. Pregnant and lactating women and growing children are most vulnerable to having calcium deficiency because they need the highest amounts of calcium, and we need to optimize their dietary calcium intake almost to the tune of at least not less than 1000 milligram of calcium per day. If that is not met by dietary needs, as we'll discuss, we have to go for supplementation. But after a certain age, after say 30 years of age, generally the requirement of calcium, daily requirement of calcium may come down, especially when important life events of pregnancy, puberty, and lactation are over.
Thank you, sir. When we speak about calcium and optimization of calcium or bone health, we usually speak in context of, postmenopausal osteoporosis or in the context of women's health. Professor Dedmalia, sir, could you tell us, is calcium intake as important for men, and what are the recommendations for calcium intake in men?
Yes, again, this is again a one overlooked area, strangely, in men, because generally women are more overlooked, unfortunately. But here again, we mainly focus on postmenopausal osteoporosis, forgetting about the bone health of men, and especially calcium is also equally important with regards to bone accrual, with regards to bone health, maintenance of bone health. And again, their recommendation, especially in the growing age, is in similar line, 1200 to 1300 milligram. This is the whole World Health Organization recommendation with regards to average calcium intake between 11 to 18 years. But after 18 years, after the growth gets over, generally the requirement goes down a little bit, like about 1000 milligram is sufficient, especially according to World Health Organization, and even European and US bodies suggest between anything between 800 to 1000 milligram. But again, after 50 to 70 years, especially after 70 years, again the requirement increases because of higher risk of osteoporosis. And again, the male, especially, even if you look at Mayo Clinic recommendations, they recommend that after age of 70 we need to increase the uh, average daily calcium intake to again to 1200 milligrams per day. So that actually corresponds to a women postmenopausal osteoporotic women age group and risk factors as well. So generally about 1000 milligram in adult male, and after 50, especially after 70 years, we need to go to a look at a requirement of about 1200 milligram per day.
Thank you, sir. I think the key message is osteoporosis does not affect only women, though they may be affected earlier in the age, but it's in fact, men are also equally affected. And in fact, studies have shown that mortality and morbidity is more in men with fractures as compared to men. And I think we should be giving more emphasis on calcium intake and evaluation for osteoporosis and treatment of fractures in men as well as much as we do for women. So, Nishant, sir, the next question is for you. What are the recommendations regarding calcium intake for women, and what are the recommendations in pregnancy?
Right. So when we talk about the recommendations for women, there are two aspects which we need to be aware of, and both have been alluded to by Dr. Siren Gupta and Dr. Sanyal sir. One is the postmenopausal period, and other is the pregnancy and lactation period. Other than that, during the growing years, as children or as young adults who are not pregnant, the requirement is same for males and for females. But I'll first talk about menopause. In menopause, there is a sudden drop of the female sex hormones, and which predisposes to the condition of postmenopausal osteoporosis, which is the probably the major cause of fractures throughout the world. So, to improve the bone mineral density in these patients, in these females who have gone past menopause, it is important that they ensure that their calcium intake is at least 1200 milligrams per day. That is around 20% more than what is there in the premenopausal period, that is 1000 milligrams. Similarly, if you look at the pregnancy and lactation period, you can very well understand that the growing baby would require some calcium for the developing its bones. And again, during lactation, the mother's milk will have some calcium. So the requirement of calcium does go up. And it is again the same. It is 20% more than the non-pregnant state. It's around 1200 milligrams. So it is very important that both these are met, because not taking enough calcium during pregnancy and during lactation can have severe consequences. You can have osteomalacia leading to fractures and deformities, and we've seen very bad cases come to us who have not maintained the calcium intake during this period. So most of the people are aware about the postmenopausal thing, but definitely adequate emphasis has to be put on the lactation and pregnancy also. Thank you.
Thank you, sir. We've now spoken about the various recommendations for calcium intake in various age groups, with an emphasis on certain age groups or periods in life where they are more prone to have calcium deficiency and should have optimal calcium intake and also supplement if necessary. I think one key message is that we should always be looking at the dietary calcium intake, how much a person is consuming, and then go on to determine if supplementations are needed. Professor Neelanjan Gupta, so this question is for you. So, if at all we do determine that a person's calcium intake from the diet is not sufficient and may require supplements, what are the different calcium supplements that are available, and is there any clinical condition where we should prefer one supplement over the other?
Yeah, that's a very pertinent question, because very many calcium supplements are available in the market and the manufacturers claim superiority of theirs over others. Uh, Everything that is natural is sometimes touted to be good, but when it comes to calcium, it is not so. Natural calcium sources like oyster shell calcium or bone ash calcium should be avoided, because that may have certain toxic contaminants like mercury or lead. So it is the synthetic calcium that is better. Regarding the calcium salt, calcium carbonate is the most widely used salt for supplementation, but that requires gastric hydrochloric acid for its absorption. So, in patients who are having achlorhydria, meaning a situation where there is lack or complete absence of gastric hydrochloric acid, or following some gastric surgery or with some concurrent medications, there are certain salts like calcium citrate malate, calcium gluconate, and calcium lactobionate, which do not require gastric hydrochloric acid for their absorption. The common such preparation that is available in the Indian market is calcium citrate. So, calcium citrate, though more costly than calcium carbonate, does not require gastric acidity for its absorption. So, in achlorhydric persons, that should be preferred. Otherwise, calcium carbonate from a good source, not having contaminants, can be used, which is cheaper and commonly available. Mind it, the absorption is something around 40%. Elemental calcium is absorbed from a tablet of calcium carbonate.
Thank you, sir. One of the most common questions that our patients have is, when should I be taking this calcium supplementation? So this question is for you, Professor Debmalya. So could you tell us what is the optimal time to take calcium supplements, and does meal affect the absorption of calcium supplementation?
Yes, again, just as Professor Nilanjan Sengupta just alluded that, we need to absorb whatever calcium we are taking. So, first important thing we need to understand, we shouldn't be taking too much of calcium at a time. So, whenever we need to take calcium, we need to take in small doses like 500 milligram. And it is very important to understand the elemental calcium which is absorbed. So, in a 1200 milligram tablet of calcium carbonate, 40% or 500 milligram of elemental calcium will be absorbed. In a citrate, it is even less, 20% is going to be absorbed. But very important is that carbonate, calcium carbonate, it is a cheaper, widely available in the market, but the issue is it is absorbed mainly when the patients when it is taken with meal, because it needs the hydrochloric acid which is secreted from the stomach for its absorption. So carbonate, calcium carbonate containing calcium tablets. So look at your calcium tablets, that has to be taken with meal for absorption. Again, an important issue which has been already alluded is the fact that if patients are taking any acid blocking drugs like PPIs or other drugs, which is very common prescription, then probably this compound is going to be less absorbed. Probably we need to choose agents like calcium citrate, drugs like calcium citrate, which do not require the acid for its absorption, and it can be taken irrespective of meal, independent of meal. So in patients who are taking any antacid, especially the proton pump inhibitors, we probably need to choose citrate. Similarly, in elderly, when the acid secretion goes down, and also in patients with any malabsorptive disorders or inflammatory bowel disease, this agent, calcium citrate, again is preferable. And also patients having some GI intolerance with carbonate, citrate is preferable. But you look at what you are taking. If it's carbonate, we need to take it with meals or after meals, and if it is citrate, you can take it irrespective of the meals, but always take small amount, and can take 2 to 3, at least twice daily, for better absorption.
Thank you, sir. Nishant, sir, just elaborating more on the food consumption that can affect calcium intake. Are there any specific food items that can affect the absorption of calcium?
Yes, thank you. So, as Professor Sengupta sir mentioned earlier, there are some anti-nutrients in the food, such as phytates and oxalates and phosphates, and these tend to bind the calcium in the diet, and they can reduce the absorption. But this typically occurs with the dietary calcium, less so with the supplemental calcium that we're giving in the form of a tablet. And even there, the studies show that if you're taking a balanced diet, you're taking a mixture of vegetables, cereals, etc., then these factors may not dramatically reduce the calcium absorption. But if you are consuming a large quantity of a single item, you're a food faddist, you're eating only spinach, something like that. Spinach has got a large amount of oxalates, and that can bind the calcium. In such circumstances, yes, these can dramatically lower your calcium intake, and then you can have those problems. But broadly, having a healthy diet, if you eating a balanced diet, then most of these would not cause a major issue with your diet, with your calcium intake, provided you are otherwise ensuring enough calcium in the diet. Thank you.
Thank you, sir. Professor Nilanjan Sengupta, sir, many of our patients are often on more than one tablets along with calcium. Like in pregnancy, they can be taking calcium with iron supplementation, or maybe even taking pyroxine supplementation with calcium. So, do medications affect the calcium absorption? How should they be taken, or how should they be spaced?
Yeah, that's a very practical question because calcium can affect the absorption and bioavailability of many drugs if administered with it. At the same time, many drugs can in turn affect the oral bioavailability of calcium. Like iron, calcium and iron should not be given together. In a pregnant lady, yes, we need both iron folic acid supplementation as well as pharmacologic calcium supplementation, because during pregnancy, at least in India, the diet alone is not going to suffice for the calcium needs of a pregnant lady. We have to give supplemental calcium. So these two should be spaced, sufficiently spaced apart, so that iron doesn't impair the absorption of calcium, as well as the other way around true is possible. As Dr. Debmalla has pointed out, any drugs that can tend to elevate the gastric pH, that is, the proton pump inhibitors, H2 receptor antagonists, gastric antacids like aluminum and magnesium based gastric antacids, all of them can impair the oral absorption of calcium. So, also drugs like phenytoin and very many other commonly used drugs like bisphosphonates. If a person is being treated for osteoporosis and is on oral bisphosphonate therapy, I think that should not be given along with calcium. Maybe I'm not sure about oral semaglutide, but even no other drug should be given administered along with oral semaglutide too. And antibiotics like fluoroquinolones and tetracyclines can impair the oral bioavailability of calcium. Phenytoin I have eminently mentioned, because one of the causes of osteomalacia in patients receiving long-term phenytoin is the absorption, impairment of absorption of calcium, whether supplemental or dietary calcium absorption. Gastric antacids and loop diuretics, as well as certain laxatives. So it is important to mention this because many of these drugs are commonly used in our day-to-day practice and are co-prescribed with calcium that can impair, that can have drug interaction and can impair the absorption of calcium.
Thank you, sir. We've spoken about various aspects that can affect calcium absorption. I think the key is if you're on a proton pump inhibitor, or if you're not able to take the calcium supplementation with meals, you should go for calcium citrate. But otherwise, calcium carbonate is an inexpensive a calcium supplement which can be taken. And also, it's very important to space these calcium tablets. You should not be taking more than 500 milligram at once. You can space it over 2 or 3 times a day. And mostly food items do not impair the absorption. But if you're taking a lot of, certain foods like spinach, like Nishant sir said, then that could affect the absorption. Also, in pregnancy, especially, it's very important to space iron and calcium tablets to not have either one affecting the absorption of the other. So thank you, sir. Earlier in the session, Professor Nilanjan Sengupta sir alluded to calcium having a bigger role in the functioning of the body than just the bones. Professor Debmalla sir, this question is to you. Could you tell us what other functions uh, does the calcium carry out in the human body?
So, as Professor Nilanjan Sengupta mentioned at the beginning, that we require calcium not only to build and maintain our bones, but also it is essential for proper maintenance of cardiac function, for nerves as well as muscle function, and there can be some benefits beyond the bone as well that has been putatively proposed, like diabetes, cancer. But still there is a lot of debate regarding that. But we have seen, especially it has been noticed, especially in pregnancy, again, preeclampsia can be prevented by supplementing calcium. So that's very important. Again, calcium supplementation decreases hypertension and high blood pressure risk in pregnancy. And also in non-pregnant state, hypertension, especially in subjects who are calcium deficient, correcting calcium can decrease both the systolic as well as diastolic blood pressure in hypertensive persons. And so calcium supplementation should be considered where there is dietary deficiency of calcium, especially in hypertensive subjects. Again, dyslipidemia, where and especially after an age group, is a very common problem, and high cholesterol is associated with cardiovascular disease. Again, calcium has been found to decrease the risk of hypercholesteremia, and especially high LDL cholesterol as well. And again, one of the areas which has drawn significant attention, and lot of patients ask us that, is it safe to take calcium? Will we have increased risk of kidney stones, renal stones? So first, question is commonly asked in pregnancy, because most pregnant women are supplemented. One is, there is absolutely clear data that in pregnancy, meta-analysis have shown that there is no increased risk of urolithiasis or stones by taking calcium. So that is very important. So calcium supplementation is very important in pregnancy for mothers as well as for the child's bone. Not only that, even it has been seen that not only mother's blood pressure but also the progeny's blood pressure is improved by use of calcium, and there is no extra increased risk of renal stones. Even in patients who have some osteoporosis, whether urolithiasis is increased or chances of stones is increased, kidney stones is increased by supplementing calcium, it has been seen that calcium supplementation does not increase the risk of stroke or any urine, any stone formation. Rather, it decreases, because low calcium in the body can give rise to hyperparathyroidism, secondary hyperparathyroidism, which can actually increase the burden as well. So calcium supplementation does not increase the risk of stroke, especially when it is given appropriately. And also, one need to consider with regards to what vitamin D is also supplemented along with the calcium. That also needs to be considered, because the 125 hydroxy vitamin D, which probably will be discussed in a separate session, increases the risks to some extent, but not the 25 hydroxy vitamin D, which is the recommended one. 125 is rarely recommended other than special setting like hypoparathyroidism and in kidney disease. So the bottom line is, calcium doesn't increase any risk of significant risk, any risk of renal stone. Rather, it decreases risk of hypercholesteremia, high blood pressure, if it is appropriately supplemented.
Thank you, sir. Just speaking a little more about vitamin D preparations that come with calcium. Nishant, sir, this question is for you. Often the patients are so confused that there are so many calcium tablets. We spoke about carbonate and citrate, but they come with a variety of vitamin D formulations. Some come with 250, some come with 500, and some come with something known as activated vitamin D. You can look for the name calcitriol on the tablet. So how should we be choosing from this, and is there anything specific that we should avoid?
Yes, thank you. So, what I would say first of all is that you should take the calcium preparation recommended by your doctor rather than going yourself and choosing one amongst all the numerous preparation, as you discussed, are available in the market. Because the thing is, you might need vitamin D, but how much vitamin D you need has to be established first. Let us say you are somebody who has high risk of osteoporosis, you are a postmenopausal female, you are an elderly male, you're somebody with fracture, you're somebody who does not go out in the sunlight at all. In such a person, probably it is better to measure the vitamin D levels in the blood and then take a call on what replacement doses or treatment is to be given. On the contrary, if you do not have vitamin D deficiency, then probably a very small amount of vitamin D would be enough. Um, Tablets typically, as you said, have a 200 to 500, 600 range of vitamin D. But people who have deficiency or even who have lower levels, they probably require up to 1,500 to 2,000 units per day to maintain the vitamin D in a range which is required to prevent osteoporosis. So again, these decisions are better taken by somebody who knows the topic in detail and who can give you the right advice. Similarly, coming on to the calcitriol part, which Professor Sania also alluded to, calcitriol is not meant for treatment of vitamin D deficiency in the general population. There are specific diseases in where acute vitamin D is to be used. It is better to provide the simple vitamin D to the body and let the body activate whatever amount of vitamin D it requires to be activated at a given point of time. If we bypass the system by giving activated vitamin D, then we are predisposing ourselves to the adverse effects of high calcium. You can have renal stones, as you pointed out. You could have high blood calcium, and then you could have cardiac problems, neurological problems. So it is something which should not be messed with. So as far as possible, don't choose your supplement yourself, and definitely stay away from calcitriol.
Thank you. So I think that is one of the key messages that should be calcitriol is not to be taken regularly, and there are only specific conditions, most commonly a chronic kidney disease, where you don't have the enzyme to convert vitamin D to activated vitamin D, where you should be taking it. In fact, if you take it without indication, it may even increase the risk of fracture. So, so we've spoken a lot about calcium supplementation and foods which are rich in calcium. Nilanjan sir, could you tell us, is calcium supplementation a must for everybody? Should everyone be taking it, or should all the elderly population be taking it? Is it a must to prevent fracture?
Well, this is a relative question. As Dr. Nishant has pointed out, in countries like United Kingdom and USA, where a balanced diet rich in dairy products meets the dietary requirement, daily dietary requirement of calcium, there we may not have to give supplemental calcium. But by and large, the Indian diet is poor in calcium. And especially if the diet is not a balanced one, the person suffers from food fatism. So, whatever deficit comes from the diet, that has to be managed, or that has to be compensated by supplemental calcium vitamin D. Now, coming to the vitamin D, let me add this is a very unfortunate situation in India that we have rampant combinations of calcitriol and calcium available to the physicians and the patients. And I think the regulatory bodies should think about it and make their availability restricted to special situations, but that we cannot do here. We can just only suggest do not take any preparation which contains calcitriol until and unless your doctor has specifically told you that you need calcitriol. That is one part. Regarding the supplementation of calcium, as I said, I think there are certain situations where probably you will have to go for supplemental pharmacologic supplementation of calcium with along with vitamin D. Why we have to give along with vitamin D? Because if there is deficiency of vitamin D, the supplemental calcium will also not be absorbed, because for absorption of dietary calcium, good vitamin D status also is needed. Now, what are the situations? I think first is pregnancy and lactation, established postmenopausal osteoporosis, or who has suffered an osteoporotic fracture, who has certain problems with the small bowel, has malabsorption syndrome, having nutritional deficiencies, and in growing children. These are the areas where we have to probably compulsorily have to think of pharmacologic calcium supplementation. In other situations, depending upon the dietary calcium, assessing the calcium needs as well as assessing the dietary calcium intake, we may or may not need to give pharmacologic supplementation. One point that Dr. Debmalla Shannal has also pointed out, if you consume calcium and vitamin D, that is not the calcitriol one, in moderate amounts, that even on a long term basis, that is not going to do much harm so far as vascular calcification, renal calcification, nephrocalcinosis, or nephrolithiasis is concerned. Rather, the long term effects of calcium deficiency are much more than maybe a slight excess. But yes, that may spell danger if you combine that with active vitamin D, which I reiterate at the sake of at the cost of being repetitive to be avoided. And of course, you shouldn't take a lot of calcium at one go, because if you take more than 500 milligram, that's not going to be absorbed in any way. That's a wastage. And do not take more than 2000 milligram of calcium per day. So within recommended amounts under medical supervision, even long time calcium supplementation by way of tablets or syrups is quite safe.
Thank you, sir. Professor Dedmalya, sir, this question is for you. What are the clinical signs that we should be on the lookout for calcium deficiency, and how does calcium deficiency manifest across the lifespan?
So, it can manifest across the lifespans right from the beginning, right from, in children where they can have soft bones, they can present especially with rickets, where they can have bony deformities, they can have bone pains, and especially in very young children, if they are, you're picked up, they would be crying because of bone pains, they can have hypotonia, their developmental milestones can be delayed, their gait can be a waddling type of gait as well. And very importantly, we need to see there is these or they have an increased risk of respiratory diseases and pneumonia as well. Again, severe hypocalcemia can lead to hypocalcemia, can lead to seizures, they can lead to cramps, and hypocalcemic seizures are a cause of secondary causes of any convulsion as well. Again, from apart from bones, you also can have teeth abnormalities, especially in children. You can have enamel hypoplasia, something which is very important, and also delayed tooth development. Similarly, in younger children, growth can be hampered per se because of inadequate calcium. So, short stature can be a presentation. In adults, one can have bone pain and can have weakness, especially weakness in lifting objects, weakness in climbing stairs, or getting up from sitting posture, which is known as proximal weakness. This classically happens more commonly in osteomalacia. Again, we have seen patients coming with heart failure, dilated cardiomyopathy because of hypocalcemia, and this is one of the reversible causes of cardiomyopathy and heart failure. Patients can present, as I've mentioned, just like in children, they can present with seizures, they can present with cramps, and that is very important. That is convulsion. And finally, these can, in the long run, contribute to osteoporosis and fractures as well, which is associated with significant comorbidity and mortality as well. And in elderly also, it can have an impact on causing pneumonia and death as well. So across the lifespan, calcium is very important along with vitamin D, because that goes hand in hand, right from bone to muscle to cardiac muscle to neurological diseases as well as pneumonia. It can be across, there can be varied presentations, and we need to have a very close watch both from the patient's perspective as well as from the physician's perspective.
Thank you, sir. I think one of the less known facts about calcium deficiency, even among the medical fraternity, is the role it has in the normal functioning of the heart. Of course, we know that, but in calcium deficiency, they present with dilated cardiomyopathy or even heart failure. I think it should be the standard of care to measure calcium in patients presenting like this, especially younger people who present with this. Thank you, sir. I know now we've spoken about the side effects of calcium or the lack of side effects of calcium, but just to reiterate, Dr. Nishant, could you tell us that this is the most common question that all my patients ask me. Will taking calcium every day increase my chance of having a renal stone?
Yes, so as I agree, that is a very common question that people want to know about. But calcium supplementation does not increase the risk of renal stones at all. And we are assuming here that calcium supplementation is being done properly by a doctor, and you are not consuming very large amounts of calcium supplements on your own. So, in the correct doses, calcium supplementation does not in any way increase the risk of renal stones. In fact, it can prevent some stones, as Professor Sanyal alluded to. For example, if your diet is very high in oxalate is a very common cause of stones. So if you are taking calcium alongside, then even the oxalate may not get absorbed, and then you might end up being protected from a stone rather than actually having a stone. And the most important cause of having a stone overall is not drinking enough water. If you're drinking enough water and your urine is clear in color, then you are not at risk of any kind of stones anyways. But specifically with respect to the calcium point, the supplementation taken in the correct dose does not increase the risk of a renal stone.
Thank you, sir. Just to summarize what we've spoken about today, we spoke about the various food items that are rich in calcium. It's mainly the dairy, but we also have vegetarian sources of calcium. And we should be determining the patient's calcium intake, which is individual to the patient, and then determine if the patient will need calcium supplementation. Another key message would be, do not take calcium supplementation over the counter by yourself. Always take it only if you're prescribed by a qualified doctor. And also important to look at the calcium content that you're having, carbonate or citrate, and if you're taking any other drugs that can reduce the pH in the stomach, you need to go for calcium citrate. Otherwise, calcium carbonate is a good preparation to take. Also, look at the vitamin D that you're taking along with calcium. If you're taking calcitriol along with calcium, then if you don't have any indication for it, then speak to your doctor about it and do not take it over the counter. Also, we spoke about the various manifestations of calcium deficiency across the lifespan. If you think you could be experiencing one of this, you should get your calcium levels tested, and there will also be a host of other tests that could determine what is causing your calcium deficiency. So thank you, Professor Nilanjan Singh Gupta, sir, Professor Dedmalya Sanil, sir, and Dr. Nishant Raizada, sir, for joining us today. I think we had a wonderful session covering all aspects and dispelling the most common myths about calcium that we have today. So that was the end of today's session. Thank you for joining in. We have another exciting session coming up on October 8th, which will be more on vitamin D and the role in osteoporosis. Thank you.
Thank you.
Thank you.
Thank you.